Hi everyone, I'm Dr. Lisa Erickson, and today I want to discuss a very important muscle called the coracobrachialis muscle. This muscle is very prone to giving issues in the front of a shoulder's chest, and it is not actually on the bone itself, but actually more in the deep cavity on the front of the chest. So finding this muscle, if you were to trace your clavicle up and over, so we run our fingers along the bone itself, as we get up into a corner up there, if you bring your finger just below your clavicle, you may find a little balled up round knot of a muscle. And if you were to twang on this muscle, it runs down into the arm bone itself, and that is the coracobrachialis muscle. Symptoms you may feel if this muscle is tight is: 1, we don't have flexibility of opening up our chest. 2, you may have pain on the front of the shoulder. You may also notice symptoms that come down the back of the arm and down actually into the middle finger. This is what we call a trigger point referral pattern. If you're interested in that, you may check out Janet Travell and Simon's trigger point manual. There's a bunch of really good referral type trigger points in there, but this muscle is important, so I wanted to show you some stretches and some self-care stuff that you can do for yourself. So the best stretch that I recommend for this is a doorway stretch, and that differs from a doorway stretch from your pec muscle because that stretch is done with the elbow up to the side. The one that I'm going to demonstrate, the elbow is actually held straight and down below you, and we're actually standing just in front of the door, and the positioning of actually holding your torso away from the door is what actually stretches into this muscle. The goal with these stretches is to relax into it, to try to breathe into the tight area, and then also to ask that muscle to relax. If you stretch too aggressively, we teach the muscle to protect itself, and it doesn't actually, or I guess I should say it's not actually given the ability to relax. So we want to stretch just enough that it feels like a nice, good, deep stretch, and the goal is 60 to 90 seconds. So let's go ahead and step into that posture, and then I'll give you a few more feedback tips for holding that posture correctly to get the most out of your stretch. So standing in the doorway, our elbow is straight. We're standing just in front of the door, and we are twisting our torso away. So I want you to feel a really nice, good stretch through the front of the shoulder, and I also want you to really try to relax into that, and instead of scrunching our shoulders up towards our neck, I really want you to try to go the other direction, elongating out through the shoulders and opening the front of that chest. So rotating our body away from the door, I really want you to focus on the rib cage and focus on rotating that rib cage around away from the door, and you can assist that with your opposing arm of grabbing around the rib cage and holding and pulling and stretching. And the whole goal is to breathe into this area, asking it to relax, and then just trying to quiet your body and breathe into that area. The goal is 60 to 90 seconds of stretching, and this is something that hopefully will help with all of your other self-care that we're giving you, which includes doing pinpoint muscle work, holding with a tennis ball or lacrosse ball into that area, and then also doing stability type drills where you're learning not to round your shoulders forward and almost wear them like a coat. In patients that do tend to be in this position, that muscle always gets tight and contracted, so really holding the shoulders back. And perhaps another practice session for you would be, instead of squeezing those shoulders up towards the ears, to elongate them down and out to the side, and use that as a good starting position with climbing before you load that joint, and then having that chest nice and open. So that is an excellent stretch that I just showed you for the pec muscles and the coracobrachialis muscle. Another would be to just lay with some sort of a block or a foam roller underneath you, and to extend your arms to the side, stretching in through that area. And the goal is 60, 90 seconds, if not longer, of breathing into that area and asking it to relax. So I myself like to use a yoga block behind my shoulders, kind of right where a bra line would be, and then also right behind your head, kind of in a T shape. So the one going up the spine is this direction, the one behind your head is that direction, and then we lay on the blocks with your knees bent or straight, and then just extend the arms out to the side. So I do love this doorway stretch I showed you, and then also this laying pose I described. Give that a try, and then let's see if we can get your shoulders back to fully functioning. Because with that tight and your shoulders rolled forward, you lose quite a bit of strength. So let's try to get that back and see if we can prevent future injuries. Thank you for joining me.